Hi, I'm Heidi, your smiling host. Now, we all remember at least one person who walked into a room and as soon as they smiled, the room just lit up. It was so dazzling. A smile speaks volumes about you. Beautiful looking teeth say you're confident and healthy. If you want to feel confident, look more attractive, and be that person who stands out in a room with a radiant smile, then you need to meet Dr. Victor Martel. Dr. Martel is an educator in the dental world on appearance-related dentistry. Wait until you see and hear how Dr. Martel is beautifying smiles and changing lives. And if you like what you see, he can help transform your smile. Now let's meet Dr. Victor Martel. Hi.
Hi.
Thank you for letting us visit you here at your office.
Well, welcome. Thank you for having me.
Dr. Martel, you've transformed the smiles of so many people through appearance-related dentistry. I'm sure many of our viewers are wondering, what exactly does appearance-related dentistry encompass?
Well, you know, appearance-related dentistry there's many aspects of appearance-related dentistry. As far as many people might think it's just porcelain veneers, but in actuality it could be simple bleaching of teeth, could be implant dentistry, could be invisible braces. There's many ways to improve a patient's smile, not just one way. That's why we've changed the terms and now call it appearance-related dentistry.
I've seen some problem smiles that you've resolved, and you're quite the problem solver. Let's take a look at a couple of your patients' makeovers. Here's the before shot of one of your patients. Dr. Martel, tell us what this person wants to change about their smile.
Well, you know, this person is someone that was unhappy with the spacing of their teeth, and a lot of patients come into our office and they're not happy of having spaces in between their teeth. So one of the great things we can do is we can close those spaces with cosmetic or appearance-related dentistry, and in a matter of 2 visits make them look like they've had braces on for 2 years.
Is it very detailed?
You know, it is to me, but it's to the average person, it's something that takes time, takes a lot of preliminary work to work up and to get it to the point where we're satisfied with what we're going to do, and then we proceed with it. After that, the time is basically involving making it look as natural as possible. I think that's probably the most important thing. I always tell patients that if somebody looks at your teeth and says you have a beautiful smile, we did it right. If somebody looks at your teeth and says, "Who did your teeth?" we did it wrong.
Okay. It's the magic behind the curtain.
Absolutely.
Okay. Now let's take a look at the finished results. Wow, what a totally different smile. Tell us what was done to this smile.
Well, in this case, the porcelain veneers are applied to the teeth. The other teeth are bleached to blend into the color. And the purpose of doing it in that fashion is to make everything fit that patient's tone of skin, eye color, so that when that patient smiles, it doesn't appear as if it's something that was done. It just appears as if they grew that way, or in essence they were born with a beautiful smile.
So you actually match the color of the teeth to that person's skin tone and eye color?
Absolutely. Yeah, the skin tone and eye color is very important in a smile makeover, because, for example, someone with lighter skin like you would look more natural in a lighter color, or somebody with darker skin, if the teeth are too light, it appears false and unnatural. So we tend to really go by eye color, hair color, skin tones, and that's how we accomplish something that looks like they were just born with it.
You know, now that you describe that and explain that to me, you're so right. I can remember kind of having that shock value when you saw some person walking down the street and you say, wow, that it's a beautiful smile, but it really doesn't match that person.
Exactly. Yeah, one of the most important things that I tend to look at, and probably I'm a little bit too critical of, is when I see somebody in a room that their teeth light up the room and walk in before they do.
Their face.
Right.
Let's take a look at another patient makeover. Now, here's the before shot, and tell us about this patient.
Well, you know, sometimes a smile makeover or enhancing someone's smile can be a lot more involved than what you can see with the eye, and sometimes it involves the entire mouth, whether it be implant dentistry. Sometimes it involves bleaching, sometimes it involves orthodontics, and in this case it involved all those disciplines, and it took that much to get that patient not only pretty and natural, but functional, which is very, very important when you do a smile makeover.
I can't wait to see the transformation. Here it is. Another unbelievable smile. Now tell us what you did here.
Well, you know, sometimes it can be something as subtle as lightening the teeth or just some rotations of the teeth, and absolutely can make a tremendous difference. So sometimes my philosophy is least or less is better, and in this case it didn't involve quite as much, but it still made the patient feel very confident and gave them a beautiful smile.
Gorgeous smile. Dr. Martell, how does it make you feel to hear that you really make a difference in someone's life by improving their smile?
You know, that's probably the most rewarding thing we do in dentistry. You know, dentists aren't the patient's least or favorite people in the world, and this is one of the few parts of dentistry that you can actually make a difference in the patient's confidence, make a difference in possibly their lifestyle or their getting a better job. I think it's probably the most heartwarming thing and makes me want to come to work every day. That's why I enjoy this type of dentistry so much.
Both of your patients just exude so much confidence with their beautiful smiles. Now, one of them mentioned everything was explained to them in the consultation. What is included in the consultation?
We know consultation is probably the most important aspect of the entire process, because one of the things we do in a consultation is interview the patient. Not only are they allowed to interview me, I need to know what bothers them about their smile, how it makes them feel, what I can do, and whether I can improve that type of aspect of their smile. So looking at the patient, talking to the patient, photographs of the smile, watching them speak, because that gives me a lot of information. Those are the types of things that are probably the most important aspect of the smile, because when they're done, we want them to feel comfortable and that they've received what they asked for.
So this consultation process is very, very personal, and you can basically read as they're talking what it is that makes them uncomfortable. You know, can you see that they're acting differently with their old smile?
Absolutely. You know, probably the first thing I do notice is when people are unhappy with the appearance of their smile, they don't show their teeth. And in fact, probably over years of habit, they tend to purse their lips and not show their teeth like they would if they were confident about their smile. And the great thing that I get to see is the after effects. And in fact, I tell them, you know, once your smile's done, you're going to be showing more tooth and you're going to be smiling bigger. So maybe we need to include a few more teeth, because once you smile big, it's going to show a lot more.
I'm sure you've probably heard patients during a consultation ask about what the procedures will feel like. Right. And how will the makeover process take. Right. Now, how do you answer these concerns?
You know, many of them are surprised for the most part, how quickly it can be done. And many times it can be done in as quick as 2 visits. We can, between the procedure itself, and we tell them that there's going to be some minor discomfort, and if there's any fear or anxiety, we can alleviate that with some medication. And secondly, we tell them to be prepared to look completely different when they leave. I think that's probably the most important aspect that I explain to them before they start. Because even when you have a beautiful smile, when it's different at first, it's a change. And I give them a few days and they return and we look at them again and they're just ecstatic about what they see.
Dr. Martell, when you're not here at the office, you're teaching other dentists and students about the technology and the procedures for appearance-related dentistry all around the U.S.
You know, I've been speaking about dentistry and topics in dentistry for probably 15 years. Probably because I love it. It's probably my second passion of what I do. I love to teach, and I love to share new ideas with other colleagues that, you know, hopefully can help their patients in their community. I think that's really important, to give back to what the profession has given you. So it's become something that I'm very fond of and very blessed to be asked to do.
I'm sure thousands of people are thankful you passed on that knowledge, or else, well, they wouldn't have their beautiful smiles.
Thank you.
So thank you so much for the invite and the conversation. We appreciate it.
Well, you know, thank you, because I really appreciate sharing what can be done for patients and how to make them feel better about their lives, and hopefully it helps one more person.
And it does.
Thank you.